in majority of the cases is that I tend to run into issues and numbers that I sometimes tell my producer, you know, the best way to do this interview, go right in and ask these questions to the experts. So today, for all those people who want to know what it is that we're going to talk about cancer awareness among children. And that topic is essentially childhood cancer awareness. And the best way to do that then, out of the research that we got into, there are those that are quite popular among kids in the country. And what you're going to find about is the numbers are neither here nor there, essentially telling you how bad that particular situation is. So if you look at the numbers that we have here, you will see the majority of those diagnoses among children in the country normally start from ages of 0 to 5. And we're looking at it 31, 6 to 10, 11 to 6, 16 years of age. That's where majority of those numbers lie. So if you are essentially going to look at those numbers, you're going to see again that the percentage keep on growing. From 0 to 5, that's when you have a very little percentage in terms of the spread of cancer. And then as you grow by those ages, that's when you find that these percentages keep on increasing as well. Also, which is telling that indeed probably we wait longer before we start then to take these conditions or these symptoms more serious. It's a good thing I do have experts on the set this morning. Let me then introduce them as we go by talking about this particular subject. Next to me, I'm seated next to Elsie Mulindi, who's the CEO of Faraja Cancer Support Trust. How are you doing?
I am fine. Good morning.
Good morning. Welcome. Just before I introduce my next guest, this issue of cancer awareness among children, how bad is it in the country?
I would say that in our country we have had a lot of significant strides and a lot of realization
Yes.
Amongst ourselves,
Yes.
that first of all cancer is something that we need to focus on, both for the adults and for the children.
Does it?
And also in terms of interventions, there is a lot more going around children.
Does it?
Just to create that awareness, to ensure that we have early diagnoses, to ensure that families, caregivers are responsive and very quickly at that.
Does
So that even at childhood cancer level, then we also have the interventions that we're putting in place
Yes.
for the adults, so that
Does
our
it?
children with cancer are also taken care of.
That's it. Next then, as we dive deep into this conversation, we do have Dr. Bernice Mukurea. I want to put this question to you, even as you introduce yourself.
All right.
Somebody said that, is it that we do not know much about cancer in children? That's why we never think of it as a subject.
All right. Thank you, Simba, one, for having us here to discuss this very important issue of childhood cancer.
Yes.
Like you very correctly said, we know about cancer, we know of cancer, and we mostly relate it to adults. Most of us don't think that it actually exists in children, but it's one of the leading causes of disease-related death in children. When I say children, at least for us oncologists, we lump up the people aged between 0 and 19 years as children.
As children.
Yeah, not here to offend any adolescents, but we count you all as children
As
because we
children,
tend to use the same treatments even
Yes.
for the cancers that we find in this age group. So the question about awareness, yes, cancer is not in children is not very well known around the country. Yeah, and this is for many reasons. One, it doesn't present itself and say, hey, look at me, I am cancer. It comes up very subtly, right? You can have a child having a fever. We have fevers with malaria, which is more common, pneumonia, which is very common. Yeah, so what should raise your suspicion is things like fevers that are not going after 2 weeks. It's not disappearing. You've taken all manner of antibiotics. The child has rested, but the fever is just not going away. You know, that should raise a suspicion. Again, subtle symptoms, you know, a child suddenly was writing before and now they're not able to write properly. They have a bad handwriting or they're writing out of the lines, you know. You don't think to yourself, okay, this might be a future doctor, you know, we're known to have very bad handwritings. It could be a sign of something going on in the brain, right? A child who was previously healthy, running around and everything, and suddenly develops a change in gait. They lose balance when they're walking. They're not able to, just go ahead with it, go forth with their usual tasks. Washing their face, they can't wash their face suddenly. Speech is changing, it's unusual,
Yes.
The child seems to be going back in terms of what they were previously able to do, now is unable to do. So such things can point towards cancer.
Yes.
Another thing we tend to ignore a lot is a parent or a caregiver's, usually the mother's, suspicion that something is just not right. Yeah? Always trust what a mother is telling you out there, right? Mothers know their children. So if you feel something is just not right, even you as a healthcare worker who meets them at their point of entry into the healthcare system, listen to that mom and see what's going on, then do a full examination. Look for the telltale signs of a possible cancer or a possible malignancy. Look for swellings. Yeah, you can find swellings in the neck, in the tummy, in the abdomen. Ask about changes in the child's behavior, right? As I'd mentioned before.
Yes.
Ask about how their toilet habit, has it changed? Are they finding trouble going to do a short call or a long call? Unusually. How long has this been taking place? Such things.
Yes.
So awareness, not just among the public, but also among the healthcare system, because cancer mimics all manner of other illnesses. It's very subtle in its presentation. Yes, so having that high index of suspicion will go a long way in detecting it early and instituting treatment early.
Yes.
Yes.
Pretty much. I'll be coming back to you because I've got very specific questions to you, by the way.
All right.
On the technicalities of the ages.
Okay.
That we're saying that we need to observe, but then some people would say that character in very young children, ages maybe 0 to 5, would not essentially be discerned as cancer. Some people will say, well, my child behaves like this. My child likes crying in the morning. My child doesn't take A, B, C, D. Whereas some parents assume, oh, that's the character for my child,
yes,
as opposed to being a symptom.
Yes.
I'll be coming back to you on that. Elsie, as a trust that is in this particular area, that is really integral. I mean, the government is here trying to talk about how we need to fight cancer, how we need to make advancements in cancer. What approach could be right are you taking then in this particular area to make sure that it is actually the caregivers, the mothers that Bernice is talking about, who are getting educated and touched just to know that indeed cancer among children is an issue that they need to know?
I'll tell you for sure, Simba, that cancer is very complex for any family to deal with, for any person affected or taking care of somebody with cancer. And then let's talk about the child that you have that has cancer. And therefore, at Faraja, 13 years ago, we came to being to be able to support the family, to support the caregivers, to support the mother who has a child with cancer throughout the cancer journey. And I would say that the approach that we need to embrace all together is to move along both with non-medical support interventions as well as medical treatment. These need to go together. And so at Faraja, we offer the non-medical support to the whole journey of cancer. We provide complementary services. These help to alleviate the side effects of treatment, to be able to provide a space where people can release their stress. Complementary services include nutritional therapy, very important for any cancer patient, even a child, to be able to understand then what they should take, what they should not take. We provide reflexology, Zumba. We provide general counseling. A family needs to go through that to understand what their child is going through and therefore how to support the child through that journey.
Yes.
At Faraja, we also provide information and awareness. I cannot begin to emphasize the role of information for all of us, including what Doc is talking about, our healthcare workers, information around what it is that is cancer, is not, the myths, the misconceptions, the stigma that come with it. Information is very important. It gives us power to be able to make decisions around seeking treatment as early as possible and even adhering to what the treatment regimen would be given to us.
Yes.
We also, for the child, we have a program at Faraja that we call Craft for Cure, or C4C, if you like, Craft for Cure. This is an art, a very lovely program of art, music, and dance, where we provide a space for the child to be able to speak using art, where they cannot express in words, or words are limited to even just begin to say how they are feeling when they're having long hospital stays because of cancer. They're having the side effects. My hair is falling off. Up to 19 years, as Doc said, I'm not going to school anymore. The activities of daily living have been interrupted because of cancer. So at Kenyatta National Hospital, at Moi Teaching and Referral Hospital in Eldoret, we have the C4C program.
Yes.
Weekly, we are able to draw with the children, dance with the children, have music, but it is therapeutic. We have the psychological counselors with us, so they are able to look at the child, see how they are presenting their art, see how their behavior is, and know where and then to intervene through the journey. We also provide apples and music for the and milk for the children, so that we just provide that social connection for the child, that emotional, space to be able to distress what they are going through.
Yes.
And also for the caregivers of those children in hospital, we also have a session of just supporting them in terms of support group. And then we also have support groups at Faraja. These are hybrid. We invite anybody to join into the support group. We need to come together as peers in the same journey, with the same, tumor-specific support group, so that we can speak to each other. What are the experiences that I am feeling as a mother, as a father, as somebody who's taking care, a caregiver of a child with cancer, of an adult with cancer? What are those experiences that I'm having? How can I learn from my peer? It is a safe space where and then we are able to vent those pent-up emotions, which we know that if we hold them inside, then they can even manifest in some physical symptoms of even sickness. And then finally, we also have a medical fund that we support in the treatment journey, in the cost of treatment of adults and children. We know very well the burden of cancer, the financial burden of cancer is very heavy on families in this country. And so our wholesome, holistic approach towards non-medical cancer support for the patient with cancer, the child with cancer, and also the family goes a long way in ensuring that quality of life is enhanced, and then of course the outcomes towards cancer treatment are better.
Pretty much. I'll be coming back to you on that, on why you think that's a very special service that you actually need to provide within that ecosystem. Dr. Bernes, that's a question that I give to you.
Yes.
That if you're not well educated, just to know that this is cancer as a parent, as a caregiver, for a very young child, maybe ages 0 to 5, even teenagers, how they behave, you might say that this is the character for my kid. My kid doesn't like 1, 2, 3. My kid doesn't like waking up in the morning. My kid doesn't like this kind of food, or things like this. How difficult is it to start saying that this is a cancer symptom if then you're not aware?
Okay. First of all, I do not expect a parent or a caregiver to sit and say my child has cancer based on looking at them. No.
That's it, isn't it?
All I need for a parent to do is to say something is not right with this child, and then present them to a healthcare facility. That is all. Then from there we can take what we do is we take a history. We talk, we ask questions regarding the child's general health, how they have been, if they're any medication, etc., etc., etc. Then from there we can also look out for the actual signs and the actual symptoms of the actual disease we're looking for. But the burden of diagnosing the child is not on the parent. All I need for you is to notice that something is not right. That's it. So I'd like to make a mention of that. You asked about the age of 0 to 5.
0 to 5, yes.
Yes, which is a difficult age to decide this person is this way or that way. Understandably so. So nationally we have, when a child is born, they get a birth notification, birth certificate, and when they come to in the hospital, they receive a maternal and child health booklet. That actually requires the mom and child to come to the hospital basically every month until the child is 5 years old, or every 3 months, every 6 months, depending on, there's a whole schedule. So between the age of 0 and 5, they're actually supposed to be making a lot of contact with the healthcare system, right? If you look through that booklet, there's several things to do with growth and development, to do with nutrition, to do with signs of common diseases, but also certain even malignancies like eye cancer. If you look through that book, and if you actually follow the book to the T as parents and caregivers, I think all of us fail. I know we all fail. For the first year of vaccines, all of us disappear from the healthcare system. Yeah. But a child is not supposed to come to, a child specifically, I'm speaking as a pediatrician here, yes. As a pediatrician and a hematologist and oncologist. A child is meant to come in contact with us, not because they're sick, but for us to make sure that they're growing and developing well. So the more you have these encounters, the more that's inculcated into our culture, the easier it is for us to pick up subtle signs of possible cancer or even other diseases, and then institute care early, right? So for the reason early detection and institution of treatment early is important for childhood cancer is because unlike adult malignancies or adult cancers, we can't say, we don't have a known cause and effect for childhood cancers. Cancer is not one disease, first of all, it's multiple. It can be of the eye, of the brain, of lymph nodes, of different parts of the body, right? And they manifest in different ways. I think I'm losing my trail of thought, but I'm coming back to interaction with the healthcare, system. Yes. So if we have it in our culture that every month we're taking our child for vaccines, every 3 months, we're checking their growth, we're giving them vitamin A, we're giving them these other things. We'll also have a chance to ask, the questions that disturb us when you're at home and you just forget. The other day, this one lost balance and fell, had a big bruise that was unusual, what was that? And then that's a point at which we have a chance to make an early diagnosis. Yeah, so I can't overemphasize the need for
this early constant touch with the healthcare system, isn't it? Pretty much. On that, just before I cross over to Elsie, I mean, for any parent who's listening to you and saying, well, what could I be doing wrong that might be exposing my child to cancer? Is there one? That's what they say. In every disease, there's something that you might be doing wrong in your lifestyle that might be an exposure agent.
That is true. Yeah. So again, I'll go back to the difference between childhood cancers and adult cancers.
That's it.
Yes. So when you're speaking to adults, let's talk about lifestyle things that could contribute to development of cancer. For example, smoking is a known cause of lung cancer. Alcohol use, bad diets, all these can lead to changes in the body that lead to cancer. However, for children, majority of cancers are not associated with any particular cause, right? Which child do you know who at 3 years has been smoking for 30 years, for example?
What if the parent was a smoker?
It's very different. It's very different. Yes, there could be a cause. There's a, okay, let me rephrase. Majority of childhood cancers do not have a known cause. There's a small minority that can be attributed to genetic predisposition syndromes, Yes. You can have a syndrome that can lead you to get a cancer. You can have some intrauterine exposure. While the mom was pregnant, maybe she was a drug user or a smoker. That's not very common.
Yes.
And there's a small percentage that has been linked to malignancy in children. Again, the percentage is very small. Overall, cancer is very rare, right? It's very rare. It doesn't occur in most. What we see most is the common things. They occur more commonly, the malarias, the pneumonias, the other infectious diseases. Cancer is a small percentage. And even that small percentage, an even smaller percentage, has a known cause, right? And that's why early detection, right, from early and frequent interaction with the healthcare system or with a point of knowledge or expertise will lead to early detection and we'll address the illness early. Yes, and have better outcomes.
Pretty much. I'll be coming back to you again.
Okay.
Now, I'll say, from what I hear, your trust is essentially into psychosocial support.
Absolutely.
That we do understand that these kids now find themselves in an unusual situation where they're in constant treatment, constant care, and they have to sort of get removed from their daily routine. And remember, we're talking about kids. Kids at that particular age, that's when they're the most active times of their lives. So when you look at what you've achieved so far, on a personal level as the CEO, what makes you happy? Do you feel that indeed you're creating impact within this ecosystem that nobody really wants to get into? Because you're dealing with people who just don't want to be there. They're there because they are there. Yes.
For sure, I will tell you, we have a lot of success stories, a lot of feedback from the parents, even the children, spoken to us, that really give us a lot of joy as Faraja.
How do you tell a kid that you got cancer, that your disease is not really that good for you? How do you communicate to this kid to the point where they're well aware that I've got this disease and I'm under medication and I'm going to get better, despite knowing that I might not get better?
We work very closely with the health service providers,
Yeah.
because we are based at the hospital in terms of supporting the child at Kenyatta National Hospital, as I said earlier, and Moi Teaching and Referral Hospital.
Yeah.
And therefore, it becomes a multidisciplinary approach in how then you handle the child, how you make the child understand that this is cancer in the most simple language, in a language that does not scare the child or even the caregivers, but also just presents the facts. And that's why it's important as a country, and then we work together, both state and non-state actors, in the non-communicable diseases space, so that we are able to bring in the necessary skills that then communicate effectively to a child and help them to be comfortable within that space they are in, and then bring the family into that space, and they are able to support the child. So we do not work alone as Faraja. We have a lot of support from the healthcare workers who then are with the children every day in the wards, so that when we come in to provide the psychosocial support, we find that the child is also aware to a large extent what it is that they are going through. Although they may not quite, definitely being that they are a child, not quite understand the detail, but they are able to embrace the space and be open to treatment, be open to being supported. Because again, outcome depends on an individual really plugging into the help that is available. And so we are very happy working with the healthcare providers who then support us to be able to do the medical interventions as we do the psychosocial support for the child.
I like what you mentioned as well, that you're not just giving this to the parents and the kids who are now cancer patients, you're also giving this support to the medical practitioners as well, working with these kids and parents. Why do you find that important? You'd like to think that somebody like Bernice would be like, it's a normal day, I wake up in the morning, go get my patients, treat them, go back home. It's a job in a day, isn't it? Why is it important for you to talk to Bernice?
Oh, you will be surprised, Simba. Actually, it is just as stressful for the nuclear family, even extended, for the patient they have with cancer, as much as it is for the person providing the care for them.
Bernice, is it?
It is. It really is.
Don't they say that doctors who get attached to their patients are the worst doctors?
See, well, I've heard that. But let me ask you, if you're going to be with a patient for 6 months, 8 months, a year or 3, I mean, they become family. So you can't completely detach yourself from their lives, and so it become a one big family.
In fact, I will add, just the other day we were, just in this month where we are celebrating childhood cancer awareness, and everybody should know that September is the month of childhood cancer, and gold is the color for childhood cancer. We were in Kenyatta National Hospital, and very, very pleased and honored to be visited by the PS in the ministry, and the children were saying, these are our mothers and fathers. The nurses, the doctors, our mothers and fathers, because they are there with them for the length of the stay, that they need to be there. And therefore, the essence of debrief opportunity for the nurses who take care of the children with cancer or a cancer patient, which we do as Faraja. We have monthly debrief, a space to talk about what it is that they have gone through, seen, the emotional burden that it places on them. Is important to have that diffusing space, even for the healthcare provider, to be ready for the journey, because it is a journey, and that's very important to do.
All right, Bernice, direct question. That indeed, majority of the patients who find themselves at the latter stages of cancer have essentially gone through undetection or misdiagnosis. I was telling you off camera that majority of cancer patients will complain that what they normally get in hospitals, especially if they don't go to specialized centers, they'll go there and your headache is getting treated, your weight loss is getting treated, your hair loss is getting treated, as opposed to addressing what the problem is. We're looking at a mother somewhere in this country. What hospital are they going to walk into What are they looking for? Talk to them. Like, what if you are a mother, you're expectant, and you know that you're going to get a kid very soon, or you have children at home, and you're like, oh, I've missed being in touch with my doctors since I had this kid. It's 1-2 years on the line. What sort of hospital do you want them to walk into? What do you want them to see in the clinic they're going to walk into? Should they want to continue with that record of this is what they weigh, this is what they eat, this is essentially who they are? Yeah.
So your question again is alluding towards the level of the lack of awareness, and not just amongst the general population, but also amongst healthcare workers, isn't it? More so outside of farther away from the specialized centers, the MTRHs, the KNHs. Yeah, so that's one of the biggest things we're trying to address, you know, as Faraja, or even as medical practitioners working in oncology, right? When our mother walks into a hospital, I want her to walk in and find somebody who is ready to serve her at her point of need. You know what I mean? Yeah. I want somebody who at the very least can take a clinical history and do a physical exam. And from there, if they need to just call somebody slightly higher, that's okay. But at the very least, they should be able to take a good clinical history and perform a proper physical examination. When I say physical examination, I mean, you know, when you're told, okay, give you a minute, you can take off your clothes, wear a gown. Yes, and we look at the patient from top to toe. We look out for any swelling, any abnormality, even in their eyes. Sometimes you can find a child is not looking at you directly. Maybe the eye is squinting, or if you're in a place where you've taken photos, you can find that their eyes look abnormal in pictures. You know, that's something you can pick up even from your regular phone, or from a torch or a candle, right? If there's any abnormal swelling in the abdomen, you'll be able to pick it up. Yeah, abnormal walking style, you'll pick that up.
Yes.
And that can happen anywhere. It doesn't have to be KNH or MTRH. It can happen at any healthcare facility, because everybody at the very least is trained in taking a good basic clinical history and doing a physical exam. Then from there, they'll have a whole wide range of, this could possibly be A, B, C, D, or E.
Yes.
And maybe even at F, they'll think maybe some sort of cancer. And that's where the rest of us come in. That's where consultation comes in, strong referral systems come in, good infrastructure, you know, healthcare infrastructure comes in. So all these things all pile up into one big, sort of soup. But at the end of the day, we have to have good leadership. We have to have good healthcare financing. We have to have strong infrastructure for health and strong referral systems. That's the only way somebody who can be reached in Moyale can reach Nairobi for something specialized if they need to, and in time, as opposed to being somebody doing a history, physical exam, making a diagnosis, and then stopping there and saying Nairobi is too far. We have no road.
Yes.
You know.
Pretty much. Good. We have 45 seconds left. And I kept on saying, well, 30 minutes is enough. Anyway, 45 seconds left.
Yes.
Please take 15 seconds. How can somebody support your trust today? And in September, how would you want any other person to participate in Childhood Cancer Awareness Month?
We are inviting everybody from all walks of life in this country to support Faraja. How can you do this? In this month of September, Childhood Awareness Cancer Month, we are having a walk or a run, if you like. We are holding this at Kalro in Muguga, off Wayaki Way, just after Sigona. And the purpose of this is not only to raise funds. Yes, we want to raise funds for children with cancer, and yes, we need funds to be able to move our agenda towards supporting a child with cancer, but also to raise awareness amongst our populace that childhood cancer is something that with intervention, with good responsiveness, both medical and non-medical, then quality of life is enhanced. Every child deserves an opportunity to overcome cancer, and that is why we exist as Faraja. So we invite you on Saturday, on 30th, we begin at 8 a.m. in the morning. Come and join us at Kalro in Muguga to raise funds and create awareness for children with cancer.
I'll be there. Trust me, I'll be there.
You're welcome. I'll be looking out for you. I will look out for you.
Dr. Bednes, I'll say thank you very much for coming by. Guess what? We'll call you back again. 1 hour. Talk about cancer issues where we are, isn't it? That's it. And even bring a couple of mothers here and their kids so we can actually get to talk to them personally, isn't it? Thank you very much. Take them online back to the time that they joined us here. By the way, she's in gold because of a particular reason. And she said it. So if you know it, talk to us as well. At Lookuptv across all your social media platforms. My name is Simba Elijah Charles Kiage. Tomorrow is another good day for another edition. Goodbye.